Is it okay to do filler to the face in order to delay your facelift surgery, or is this harmful for the future facelift? Well, none of this is wrong, and even though I'm a big fan of facial plastic surgery, this is what I do for a living and it's a passion of mine, I also believe in fillers when used in an intelligent way. I do not believe in the liquid facelift because I always compare filler to honey, and if you can do a facelift with honey, well, good for you. I don't believe in this. So there are nuances that you can improve by using filler, but filler is basically for volumization. So by volumization of certain areas, we can change the perception of shadow and light on the face, and this can reduce the overall perception of an aged appearance to some degree. But facial aging goes in several layers. It's not just on the skin, it's also the subcutaneous tissue, the fat, blah, 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 blah. So you can buy yourself some time with filler if done correctly and not overdone. Otherwise, you look like you had way too much filler, and we all know these faces. And then things start to become a little bit more complicated. If you have way too much filler, you have filler fatigue. So the filler sits so heavy in your face that it pulls everything down. Guess why? Because you can't lift anything with fillers, so it creates additional weight on your cheeks, and this makes you look extra tired. Now, you would say maybe we can dissolve the filler before we do surgery. Yes, you theoretically can. And nowadays, the golden standard for dissolving filler in the face is using ultrasound, thanks to my dear friend Dr. Harry is doing so much vivid teaching on that. But what happens with dissolving of filler is you can also impact your own connective tissue, and it dries out a little bit, so the tissue is not as good as it was before. And the other thing is you will never ever dissolve all of the hyaluronic acid-based filler that has been injected into your face. I see it over and over when I do lip surgery and facelift surgery, and what happens is you have a normal swelling after surgery. Yet when you had filler injected to the face, your face starts acting like a sponge, and it pulls and drags in water even more, and you have puffy lower eyelids because of the water that sits here. The lymphatic drainage is not the same, and the swelling after surgery is way more. So I personally recommend to consider having filler done conservatively, not too much, because you don't want to fall into the whole filler fatigue, high lace journey, or maximum swelling. And if you think you had filler done 5 years ago and it's gone, no, it's not. We just recently did a facelift, and the patient had filler done 5 years ago, and there it was, shining at me, smiling at me, and I just apologized that I interrupted the beauty sleep of this filler in the cheek.